You like cats, see that?
I hope this is live. I feel like I'm getting grilled here. I like cats.
Not live yet?
You have to accept it.
I think we are. Okay. Well, number 5 item on the agenda is for roundtable, and if there's anything that we want to share with the meeting.
I have something to share. In Moosomin, the last provincial budget allocated a new daycare for Moosomin, and the Southeast Cornerstone School Division offered a piece of land at the playground of McLeod School for that daycare. The community appreciates the land that they're being sold for a very small fee, hopefully. And they also appreciate the work of Jeff St. Onge, our superintendent, and Keith, our director of education, in helping work with the community to come to an agreement on how that will all look. So just extending thanks from the community.
Great. Good news for Moosomin. Okay, anything else?
A couple of things. The first is that I attended the Festival of Stars for the Weyburn Music Festival way back in March. Seems like eons ago. It was a very lovely evening. It was during sanctions, so actually the committee had to pick up and do it without the teachers' support. But it ran very well, and it's a very nice evening. Some really talented musicians in his town. I was impressed. And the second thing is that most of us attended the SSBA Spring Conference a couple weeks ago, and there were different presentations. Maybe people want to talk about some of them, but the one I really found interesting was the Aerocross land-based learning presentation. That was very interesting, and I think an excellent use of resources for the town and for other people to look at. It's very well put together, and it's on their website, I think. So,
Very good. Yes, that was very enjoyable. Does anyone else have anything else? Well, hearing none, welcome Tracy. Tracy Kemp was here to do a presentation to us today on learning support. So we're looking forward to that. I'm going to wheel around to this side. Sure. I'm out of the way. No.
I'm doing multitasking today. So I'm Tracy Klenick. I'm the Learning Support Coordinator for the school division. I don't have Cheryl with me, so Cheryl and I both said. Cheryl presented earlier, and we've been doing it together for so many years. So it's kind of odd being up here without my Cheryl. So, but today I'm going to present to you our intensive needs student data, some professional development that we've provided to the entire school division, including our SLPs, counselors, RTI coaches, LSTs, and along with some safety planning, and also going to talk a little bit about Jordan's Principle and our speech language pathologists that are new to my portfolio this school year. So this first slide is just based on our intensive needs student data. This is what I report up to the ministry every December. So last year in December, we had 209 designated intensive needs students. And so our intensive needs students are supported by our learning support teachers, and they also support our classroom teachers with programming needs, whether they be behavioral, academic, sensory. And then in this school year in December, we had 237. So we are up about 28 students, but we also have, that's like we have January to June where we have new families moving in. We have new students in pre-K that may not have been identified until spring. And we're seeing a lot of our kindergarten kids coming in with intensive needs. And we've had a lot of new families move into our rural communities over the past year as well. So And for multiple disabilities, it doesn't mean that a student is more complex. It just means, and I'll show you on the next couple of slides, that they may have more than one designated disability. So this slide is our occasional supports, and then the next slide is our frequent supports. So, and these are the categories that the ministry sets out. So if a student's been diagnosed with a visual impairment, then we check off one of those boxes, and then that information goes up to the ministry. These numbers won't jive with our total number, because some kids may have a visual impairment, but they also may have an ASD diagnosis, so they'd be counted in there twice. And how we determine if they're occasional or frequent supports is we look at our school level support, we look at our school division support, so that's our SLPs, our instructional coaches, and then we also look at outside support, who they access for, if they see the doctor, the pediatrician, Wascana, or low vision up in Regina. So one of the, with other diagnosed, so anything that doesn't fit in those categories, so if they've been diagnosed with ADHD or a genetic disorder, so basically anything else, and it's been diagnosed by a medical professional or an outside agency, they would go under other diagnosed. And undiagnosed, so we do support students that don't have disabilities or designated diagnosis, because we don't use the medical model any longer. We use it's all based on needs. So we do have a number of students that we support in that area. This is the frequent. Just one of the things I wanted to point out here is our autism. Our students being diagnosed with autism is increasing. So currently we have 87 students diagnosed that are on the autism spectrum out of our 237 students. And we have a number of students that are currently on a wait list to be assessed for ASD.
Tracy?
Yes.
Michelle just asked this morning, like, are we getting more? Is it just that because we're picking up these kids, or are we getting more kids, or?
I think it's a combination that they're doing early assessments earlier on our students, and a lot of our families are going to private professionals and being assessed. We also have a number of students this past school year that are in grade 10 to 12 that have gone to private professionals and been diagnosed, that are on the spectrum but are extremely high functioning, but they still receive that diagnosis. So it's increasing. I do know, in looking at our pre-K, just the kids that our early learning and care coaches are working with, and probably the most I've seen in probably since I've been in this job. I know for sure there's 8 students in the Estevan that are on the Estevan pre-K that all been diagnosed with ASD. That's a very high number. So is it environmental? We don't know. So that's still a mystery with our kids with autism. So thank you for the question. So, and the other interesting one I want to point out is our physical health impairment. Those numbers are going up, and the majority of those students are diagnosed with diabetes, our children. And so we do support like our early years, not necessarily their intensive needs, but when they're diagnosed in kindergarten and grade 1, they need those additional supports to manage their diabetes. We also, unique to Southeast Cornerstone, we, through the student success process and looking at our impact areas, we have diverse needs students. So these are students that don't quite need intensive needs, they don't need that IIP, but their needs are pretty significant, that they need a learning support teacher. Usually these are students that have a lot of outside agencies involved with them. So last year we had 81 diverse needs students, this year we have 70. And that could be because the students have graduated out, or because the students may have moved off. Sometimes they'll be on diverse because of behavior, and then when we get programming and things in place, then they might move completely off. Or some of those students, their needs may have increased and we move them to intensive needs. So we work through the student success process, which I'm working through right now with all our schools and our coaches and learning support teachers. Then we have our high school pathways. So for our students in grades 10 to 12, they may enter into an alternate education pathway. So they'll get an alternate education certificate. So their main focus is on work exploration and life transition. All of their courses are mainly academic though, and are like the 18 level 2838, which align with the regular curriculum. And so currently we have 10 students in grade 10 to 12 across the division that are enrolled in that alternate pathway. And that number I think goes down next year because we are graduating out quite a few this school year. We have 28 students across the division that are enrolled in grades 9 to 12 in what we call a FIP program pathway or functionally integrated. So these are students that their needs are so individualized that their main focus is we want to make them as independent as possible before they transition out. Most of the students that are in an FIP will stay with us till age 21. And their main focus is on life skills, but also on the interests. Based on their interests will be in inclusive classrooms such as choir or art or gym or drama, cosmetology.
That 10 students in the alternate education, are they going to an actual school, or is that like adult education where they're going somewhere else? Or?
No, they're all in our school. They attend like the regular grade 10, 11, 12 classes. It's just that their programming is, they don't like where a regular student has to complete, say, 10 outcomes. They may only complete 1 or 2 of those outcomes, and then they get the alt credit.
Where did the ones that go back after a year or two and get their grade 12? I know one of St. John's teaches in Estevan.
They up to the age of 22, they can come back to the school.
But they go to the school.
Yeah, they go to the school. Or we also have a piece that we operate with the college, where if it's not a placement for school, if you're 20 years old already and you wouldn't fit in a normal school, they also have adult education classes at the college that the tuition flows through us too. So
Is that where St. John's, is it the college on it, where he teaches, you know?
could be. I'm not sure.
Who's that?
I don't know, it's not Jeff. Anyway, a teacher, St. John's, he teaches an alternate class somewhere in Estevan. And after the kids have dropped out for a year or two, then they come back and get their level 12.
That's probably at the college,
Yeah.
because then you can get an adult 12. But most of the students that are enrolled in our alternate education are usually have an intellectual disability. And so cognitively, most of them are like reading at a grade 4, 5, 6 level. And so, but we're very careful about the students that we move into an alt pathway, because as soon as you have 1 credit at that level, then we've closed all doors to post-secondary pieces. So we have a really good process in place to make sure that we're putting students into the appropriate programming. And if you're in an alt ed program, you can receive credits in modified and regular too. We had one student that was enrolled in, she wanted to take psychology. She was taking psychology 18, and she actually got the psychology 10 credit because she was able to show the classroom teacher that she could do those outcomes. So very individualized there. Any questions about that before I move on to the next one? So the next 2 slides are going to focus on professional development that we provided to our LSTs, our RTIs, our coach, our administrators, our classroom teachers, and all of our support staff. So we focused on sensory, self-regulation, and behavior. So this is just our overall Tier 1, Tier 2, Tier 3 support. And our RTI coaches and our LSTs are very well versed with our Tier 1 and Tier 2. And one of the, when we did our survey, it was classroom teachers. Can we provide classroom teachers with supports that they need? Because we're seeing such an increase in dysregulated children and teenagers in our classroom, and teachers. So initially, this was to be a year-long PD for our learning support teachers and RTI coaches. So on September, we had our day one. That included RTI coaches, LSTs, SLPs, that's our speech language, instructional coaches, and our OT. We did an online day, half the day, and we gave them homework to go away with. Then we had a day two in November 2023. Then we did a survey, and after the 2 days of PD, they said this would be so great if we could deliver this to our classroom teachers. It's like we can take it back, but it would be better if everybody heard it all together. So we all got together and we kind of morphed it into, we presented it to the administrators, and then we presented to division-wide staff on March 15th. And these are the folks that contributed to that, so it was very collaborative. We have our instructional coaches, both the diverse and early learning and care. Angela Gervais is our division OT, and Kaylin is a contracted OT, so she provided supports as well. Grant, our instructional technology coach, our QBS team trainers, we had our SLPs, and we had administrators, and along with some RTIs and LSTs in there as well. So we took a lot of time doing the planning and the research, so these people were instrumental in making this a success.
What kind of feedback did you get from the classroom teachers then?
Pardon me?
What kind of feedback did you get from the classroom teachers?
It was very well received. We had quite a few requests for the resources that we shared. We had a request for more information on quite a few of the topics that we covered in there. We've had a list, I've had a request from, I think, 6 administrators now on items to purchase for their sensory rooms. So it was very well received. When my coaches have gone back out into the building, they said, surprisingly, like high school teachers are harder to pull into a lot of things, but they found the feedback that they've gotten was that they found it informative and they learned a few new things. So that's always good to hear too, when we get that they've learned a few new things. So I'm just going to share a bit with you what the presentation was all about and what information we're sharing with the teachers. So these are your 8 sensory systems. That was the first focus that we shared with them. Yeah, let's do this. So this is the overview of the sensory system. So we all know we have 5 exterior senses: your visual, what you see; auditory, hear; gustatory, I can never pronounce that one, is your taste, and olfactory is your sense of smell; tactile is your sense of touch. 3 interior senses. So these are newer to us, and these are the ones that really affect children and teenagers with regulation in the classroom. So when we're talking about vestibular, that's the sensations in your inner ear, and that is perception of left and right. Proprioception is your body awareness. So children that are clumsy, children that tiptoe, children that stomp their feet, they may have some concerns in that proprioception sensory area. And interoception is your internal. So like when my screen went blank, my heart started racing and I'm like in panic mode. So that's an interoception. When your stomach growls, it tells you you're hungry. When your bladder's full, you know you got to go to the bathroom. So all of those things, and some of our kids don't recognize that those feelings are connected to an emotion. So that's one of the areas that we focused on as well. Then with all the senses, this just comes, we went into if kids are sensory seeking or if they're avoiding. Some of our students have been diagnosed with a sensory processing disorder, so that's neurologically their senses aren't functioning the way they should be. And then the dysregulation, self-regulation, and co-regulation was the focus that we moved into with the professional development. So I'm not going to go through each of them. I'm just going to share with you the tier 1 supports that we provided to everyone. So what we did was we have the visual system here, and so it helps you children, like this is your seeing and to detect objects. So a lot of you'll see instead of telling the students, you'll see your visual timers in the school. So we went into great detail about what a visual system, what you would see. Well, just clicking on me, so it tells me I need to go. And then we went into for each one, what you might see if they're avoiding that, or what if they're seeking it. So lights flickering, fluorescent lights, lots of kids are bothered by that. So, lots of times you go into a classroom and there's no lights on. And even though it might be only good for one or two, you may have all, which just keeps popping ahead of me. This because I pulled it from another presentation. So we did that for each of them. And then we talked about strategy. So we gave them, so if they are avoiding, here's some strategies you could use. We do have a couple kids that wear their sunglasses all day long, just because any light distracts them. We have, this is seeking, so here's some fish tanks are very effective in classroom for kids that are seeking that visual sensation.
Got the white.
So, and this is the interoception one. So this one, again, what I talked about, like your growling stomach, your racing heart, those ones. This interoception curriculum by Kelly Mayer, most of our schools have this, and our learning support teachers, our RTI coaches, our counselors, and our SLPs will work individually or in small groups to provide this type of support as a tier 3 support to kids. We are trying to figure out how we can more do it as a tier 1 support, so getting kids to recognize one of the biggest ones is when somebody gets hit on the playground and you see big emotion. And so how are you feeling, talking about those things, getting teachers to ask it reframe it and ask it in a different way, because sometimes if you don't address that, then it grows bigger and the behaviors grow bigger. So we often see this. We see kids going to the bathroom a lot. I like hand up, going to the bathroom. They don't really have to go to the bathroom, but they're just trying to avoid something in the classroom. So, but they also may not realize that I don't know why they need to go to the bathroom. So sorry about that. So this is one that we have worked a lot with our tier 2 and tier 3, and so now expanding into tier 1 pieces.
Tracy, you piqued my interest a while back when you said about kids tiptoeing. You said something about if you see kids tiptoeing.
Yeah, if you see them tiptoeing, sometimes it means that they're seeking a different sensation than like they're trying to ground themselves. And so sometimes when they'll walk on their tiptoes all the time, it's a concern because they're not able to regulate by just normal walking. So they're using their tiptoes for a different sensation to regulate.
The reason I piqued my granddaughter, she walked on her tiptoes for at least 12 years.
So her way of self-regulating was by walking on her tiptoes.
And now she's at the comp in grade.
Yeah.
But she's been good for the last couple of years, but she always tiptoed. We always said, why is that kid always tiptoeing?
Yeah, that would be one of her senses that she's seeking a regulation there to keep herself. Because we all find different ways to regulate so we can function. And so that's one of the ways. And some kids that are stomping, that's their way of regulating their bodies. And then even though it's disturbing to others, that they're grounding themselves so that they're not like hand reaching and touching the other kids. And
Hanging onto the wall.
Yeah.
Another one. They can't ground unless they're touching the wall.
Yeah. So this was just the homework that we gave to our, this was for our learning support teachers and RTI coaches. So they went back because we wanted them to focus that sometimes it's sensory and it's not behavior. Even though you're going to see behavior, which you'll see in a couple slides, most likely they're dysregulated, and that's why you're seeing the behaviors. So we had some excellent conversations at our second day PD amongst the teachers on different students that they were thinking it was this reason, but then after these conversations, it was like this, and then we put this intervention in place. And so, I mean, then you always have tougher kids too to try to figure out what's going on. So this was their data collection chart that we just shared, and then they shared with us. And we do have some kids that like to spin. We do have kids that like to just lay down, and then they're just trying to get themselves back to their where they need to be. So that was like the pieces on our sensory, and then we moved into sensory rooms. So within our division, a few years back, we had some additional funding, which hardly heard of now, but we did. And so we provided that money for each school to design a sensory space. We do know when COVID hit, those became the sick room or the waiting room kind of thing. So we came back after, when we were back in, we came back and we brought back sensory rooms and sensory conversation. So almost every school has at least one. Some schools have 2, some have 4. It all depends. See, this is what happens when I run my own show.
Usually happens, Tracy.
In the meanwhile, can I ask you a question?
Sure.
What about children that tap?
Skimming.
That's a sensory thing as well? That's some way of grounding?
They would be seeking that sensation to keep them focused. So and we'll learn about that too here. It's the same as if we have fidgets. I have one coach that when she's presenting, she always has a paper clip in her hand, because if she doesn't do that, she can't focus on what's at hand. So it's kind of like you're keeping busy here so your mind can stay focused.
Some kids gum chewing.
Gum chewing, same, yeah. We have a lot of kids that will chew their pencils. Pencil chewing is another one, and it's to keep your mind focused.
Okay, so in all these things, as they're identified, that their intellectual disability or learning whatever it is, ASD or whatever, is there medication that, like, is there some of these things?
A lot of these kids that have the sensory and they're not identified intensive needs kids.
Okay.
There are regular kids in the classroom.
Okay, so it's not like the kids are. It seemed to me there was a time whenever a kid was ADHD, they were on Ritalin. All these kids.
Yeah, and a lot of our kids that are ADHD or have other diagnoses are on medications to help them calm their brains and stay more focused. But they still may need other fidgets or other sensory plans so that they can stay regulated. And we also want to teach them how they can stay regulated. So recognizing, like, for example, recognizing if you need to tap your pencil or chew your pencil, that's you're self-regulating yourself. So, and those are all good, and like we do it as adults. We do it. So I talk with my hands to regulate. So yeah. So we all do it in some way. Some of us will rock in our chairs, like spin in our chairs, just to stay focused. I know I do that when I'm tired if I'm in a meeting. He's doing it right now. I didn't expect that was like a stupid emotion. I'm looking this way.
And if you give me a clicky pen, I click it into my fingers because I know it annoys people. So I
click my
click
pen
it so they have all these
Some
dots on
people
my
doodle
hands.
steady, some people.
Yeah.
But it works for me.
Yeah, but these are all little tools that we picked up along the way. And what it seems now is our kids, we have to teach them these tools and why they need to use them, and that it's okay that they're drawing on their doodling on their papers, because they actually are paying attention and listening. Your sensory rooms are, most of our kids that use our sensory rooms are our higher level of need. They need these specific targeted interventions to be able to regulate, to go back into a classroom and to learn. So the one thing we try to teach is that's not a room for behavior. If you have a student with behaviors, the sensory room is when they're highly dysregulated, not the place to be taking them. It shouldn't be used as a timeout room. We shouldn't force the students to do the activities. If they're not wanting to do something, they are recognizing, I don't need that. I don't need that activity to keep calm. And it shouldn't be used as an alternate workspace. And we always want to provide specific sensory jobs. So whenever a student is using the sensory room as part of their plan, they have specific jobs when they go in there. And I have a great video that's going to show you this of it in action in one of our schools. So for each, within a sensory room, we need to target all of the senses. So for each of those, and I'm not going to show you all of them, so for our vestibular, which is our sense of balance and movement, we've given them some must-haves. So to address those needs, you must have a mini trampoline, a rocking chair, and exercise ball. So in almost all of the schools, you'll see those pieces in there. We've got, if a student needs to be alerted, those are activities, but if they need to calm their vestibular system, those are rocking chairs and hammocks are usually the best. And then we did the same. You'll see this squishy machine. Kids love that. It's a foam roller. They roll right through it and they just kind of squish their senses back in. So you see that a lot. This is a pea pod. So the kids will climb in there and they like that enclosed space. I used to have one student that would go into an empty cupboard all the time. He needed that calm, nobody around him. He'd come out in a couple minutes and back to learning. So,
Are these sorts of behaviors learned from their environment, say traumas in their environment, that sort of thing, or are they internal developmental issues?
I think it's both.
Okay.
Yeah, I think it's both. I think our devices contribute to a lot of the dysregulation too.
Okay.
The increase of, and it's just, we're all on our phones, we're all on our computers, those pieces. Trauma, we do definitely see a lot of dysregulation in our students that have experienced trauma. Most of our kids with ASD senses are not where their systems aren't where they need to be. Developmentally, pre-K, I don't know if it's developmental more so than related to a diagnosis when it's in the early years. That's good question. Next research. This is Oxbow Prairie Horizon School. So this is their sensory space. So you'll see they have like the foam roller and the exercise ball, and then they've got visual timers here. They've got music. Some kids like to listen to classical music. And then they've got a pea pod. So they've done a lot of, this is just one. Oxbow has 2 spaces, I believe. This is Hillcrest School. So this is like a very calming space, except they do have your alerting activities. So even though they come in, it's more so the calming, there's still those, if those kids need those. Hillcrest, I believe, has 3 spaces, just because of the needs based in their school, they've developed 3 spaces. We also have a number of schools that have developed these sensory carts because they want them in the classrooms. They don't want kids going out, and this is where you'll see a lot of the fidget. So like the little fidget toys, this is a seat. It's like a wiggle seat. You'll see a lot of those in the classrooms. Wedge seats, you'll see a lot of kids sitting on those and rocking on them, just so they can stay focused to learning. And then, because we got this new up to date, I have to show it this way. Uh-oh. Why am I showing? Oh, we worked on this yesterday, Karen. Oh, here we go. There you go. So this student does these activities 3 times a day just so that he can regulate himself to go back in the classroom. He's a student that came from Ontario, and when he first came to us, couldn't be in a classroom because he couldn't regulate at all, and now he's in the classroom about 80% of the time. There's that phone. They love going through it.
So, can I ask, like, is this child capable of learning?
Yes.
He's not an intellectual, not an issue that he can't learn. He just can't stay still to learn. Is that it?
Yeah, but he's so unregulated that all of that was standing in his way of learning. So they worked really hard at the school to get him regulated, and yeah, he's reading and
So good to hear.
yeah.
I like the swing.
Meditating.
So,
So I had to share that one because that comes from one of our schools, and
Tracy, for most of these individuals, is that a lifetime thing?
that in terms
The
of
need of the sensory,
not always, no.
not always.
No. Once we've given some of them the tools that they need to function, they're fine. Like fidgets or sensory things, they're good to go.
So they can result in adult, like Keith, and just
Yeah.
bites his pen.
It's
Yeah.
it's squishy global, eventually throw in a paperclip because it's
Yeah.
not socially accepted and you fit in.
some of
Yeah,
us like
like at my SLP meeting, I have one SLP that
some of us are like that.
she the entire day she had 2 fidgets in her hand, and
So
I
the,
mean,
the trick is to find coping mechanisms.
to find what it is.
Do you remember Cindy Temple?
Tracy, do you have examples of those kids
She
that
used
come
to
in
bring
needing to
fidgets
be
for me every
elevated
year.
versus
Oh,
their
She would
sensory
come and she
going
would throw
down?
me 2 fidgets
Yeah.
at the start.
Yeah, it's all right.
He was-
I click my pen all day long. It drives my wife nuts.
And I don't know why there's an increase in it. Is it an environment? It could very well be our environment. It could be our devices. It could just be the change of.
Is it virtual experiences don't allow us to experience true regulation?
That could be it.
And also, it could be just more recognition of the need.
That could be it too. Yeah.
Nobody did put me in a sensory room because I doodled all day long. And
You be good.
never told me
You
I
got your.
I could draw more violins than you will ever see.
Then you're good. You're good to go.
I didn't know why I was doing it, but now I do.
Yeah.
It's
And I think that was part of what this PD was that this next section is really was really eye-opening for a lot of classroom teachers, because when you'll see all of the things that go on in a child's life, in a teenager's life, in an adult's life, that it's like there's so many things contributing outside of his classroom that could affect how that student's learning. But just recognizing it also helps make better teachers. So, these are 2 of the books, Stuart Shanker, that we pulled most of our research from. Stuart Shanker is a very well-respected professor in the world of self-regulation. He has children that are on the spectrum as well, so it's been a lifelong learning for him. So you will now see a lot of these books in classrooms, in schools. There's a lot of requests that if we have extra budget money, can Cheryl or I purchase these books? So that's always good to hear when resources are well received. So this is the 3 principles that guide Stuart Shanker. There's no such thing as a bad kid. There's no such thing as a kid who cannot learn to self-regulate in a manner that promotes growth. That kind of answers your question there. And we can change the trajectory, the pathway that a student is on by providing them with the right tool. So there is a difference. We spent a lot of time talking about this, about the difference between self-control and self-regulation. So they're not the same thing, they are connected, but self-regulation, this is what we teach the kids. So we teach them to recognize what it is that's affecting them and to give them the tools that they need to regulate. Yeah, so this, and you'll see kids that are high energy, you'll see kids that are very, very low energy. So even your kids that have low energy, they need to be, we need to give them tools so they can be alerted, so that they can pay attention in class and be more engaged. So here are the 5 domains: biological, emotion, cognitive, social, and pro-social. They're in a circle because they're all connected. So we spent quite a bit of time going through each of these and talking about what they are, how they affect kids, and what you might do to support if that's the area that's being affected. So this is often, I think if you've been here for our other presentations for behavior and QBS, that communication, any behavior is about communication. So you may get an unexpected behavior, this is all you see, but all of these things under here are affecting what's happening up here. So this is like, sometimes it's very complicated to figure out what is the stressor that's affecting this. So, and this is often one, is you see the behavior, you use rewards, you use punishment, you use consequences, when really that's not addressing what their need is. So this is our, and what we did with them was we asked them to think about this themselves or think about the kids in their classroom. So this one is, and we all know that if our physical health is not well, if we're not sleeping, if we're not eating properly, that affects the way we learn, that affects the way we perform at our job. So these are all these things that could be affecting a child within a classroom. A lot of our kids don't like tags. A little tag can completely distract them for the rest of the day, and you don't know what's going on, and it's a tag in the back of their shirt.
You cut a lot of them out when you teach.
Yeah. So
I got a lot of them out for me.
eating noises. I have a friend that won't ever sit and eat with us because she can't stand the sound of anybody chewing. So, and that's just the way it is. Like she'll come out and go for drinks or visit, but she just can't eat a meal with us. It just, so those are, yeah. So one of the examples was too, a lot of our kids in this area may wear noise reduction headphones in the classroom just because there's just too much coming in and they can't process what actually they need to focus on. So this is the emotion domain. So these are a lot of hidden stressors. So these are the things we can't control. We have divorces happening, we have fighting at home, we might have being kicked out of class. How does that really affect a student? We don't know because a lot of those are hidden. So if you don't have those relationships with those kids, you may not know what's going on that affects the emotional domain. And this is a lot of where stress comes from. Or you may have, the fear of trying something new. And yet we sometimes expect kids to get up and present in front of everybody, and that might be, and then that's when you see the behaviors. And they would rather act out and be kicked out of the classroom than have to present in front of all of those kids. This is our cognitive domain. So this is relative to us in our working job. We're conscious of the demands of pressures, of needing things to be done, paying attention to things. Some of our kids, if they know they're going to have homework, they can't focus on what they need to get done because they know they're going to have homework on top of what they've already been given. So that stressor in their head is affecting them in the classroom. This is where we see a lot of behaviors, especially with kids who take a lot more time to process information, and teachers are like, boom, 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 we got to get it done, especially as you get up higher in the grades. And then they just start acting out or start, I'm not going to do anything, or else hoods up, head on down in the desk. You see a lot of those ones. This is our social domain. So this is teachers. So a lot of times as teachers, we worry about everything. And afterwards, when a situation happens, we'll be doing the, oh, I wish I would have done that. I wish I could have said that. So when you're doing the woulda, shoulda, coulda, that stress on a teacher adds up. And so that can present then how teachers interact in classrooms with kids. So this was interesting conversations about teachers. Like, it's focused on kids, but this one came out a lot, conversation about teachers on how the demands of the classroom made them feel more stressed because there's worrying about everybody, which is just natural.
What are supply teachers in the bottom left there?
Substitute.
Substitutes.
Oh,
It's the
okay.
American School.
Is it?
No, the bottom left, the supply teachers, it's substitute teachers?
It's a way that they call it. Other areas of
Ontario
substitute.
Supply. It's American.
Never heard that before.
Supply.
I was a
Oh.
supply teacher yesterday, Eric.
I don't know what that means.
There's
Supply,
some.
subs, yeah.
It's a sub, it's a
That's
The different name.
Having a substitute
Having
in
a
the
sub-
emotional
yeah,
stress of kids.
Maybe.
Is more work to get.
I discovered that in retirement.
Yep.
You're not my real teacher.
That causes a lot of people stress. So, and this is the pro-social domain. So this one is oh, sorry. See, I got this mixed up. This is the woulda, coulda, shoulda. Sorry, I messed that one up. I was ahead of myself. So this is the one where we put our own needs ahead of all the other kids in the classroom. So this is, we take on other people's stresses. Sorry, back that one up. When you have sick friends, when you're feeling unprepared, don't be prepared with that much. So now I'm a little stressed. My heart's racing a little faster. So.
Don't do that.
But you begin to kind of take notice. Like, I've been through this presentation with our folks 4 times now, and every time it's I'm learning something a little bit different, and even just recognizing the things in myself and approaching different situations. So
Yeah, with this, you certainly think of people, you wonder why they do things. I think this explains a couple of things, right?
So that was like we went from our senses to sensory rooms to the self-regulation. So we walked all of our teachers and support staff through those pieces. Then the next big project that's been on the go for, I'd say, 4 or 5 years, is our mythology and behavior supports towards inclusion. So we finally launched this with all of our staff, and we're quite excited about it. So we created our Tier 1 supports. So these are in Southeast Cornerstone, all of the things and supports and resources that we have in place to support Tier 1 behaviors, Tier 2, and Tier 3. And our student success process, I know we've been through this with the board before. So we've mirrored this, the behavior supports, to match our student success process, but it's all targeted towards behavior, sensory, self-regulation. So this is just a document that we've developed to help schools develop their processes within their schools. And of course, if we have any students that are exhibiting the level 3 to 5, our instructional coaches are involved right away, our administrators are involved, the superintendents and myself are aware of who those kids are. We want to put those supports in place early to try to prevent any further behaviors. And so then this is really a focus on our Tier 1 supports. And what is really neat about this document online is all of these ones will now click to all the documents that they need to support kids. So we've made it, Greg Taylor's been instrumental in helping us create this. So One of the one, I think it's in this one too, maybe it's the next one, is how to talk to parents, how to have those meetings with parents. Bringing parents in is so essential early, especially if you have behaviors, to try to figure out a plan and how you can support kids.
Interesting, Tracy, that we were just talking about this the other day at the senior leadership level, and we're talking about how there seems to be less kids coming to the student supports, the SST meetings. Part of that, we're thinking of what's going on here. I think part of that is there's more tier 1 pieces, interventions happening earlier, so that some of those kids are managing to regulate and get things to where they need to be before they ever get to the SST. So I think it's early signs of that, but it was an interesting conversation that superintendents were bringing back from their administrative schools.
Tracy,
And I have to agree.
yeah, social media would have us believe that parents just don't want to be involved at all anymore. And certainly, I mean, we see students through here that may or may not be the case. But when you're, like, as you're looking at those 237 kids that you have some measure of intervention, what percentage of parents do you feel are actively involved in assisting the school in supporting?
For our intensive needs students,
Yeah.
I would say we have a high rate that are involved, like probably 90 to 95%.
That's
Probably
good to
have a
hear.
5% that, because of their own situation, just can't be involved as much as we would like them to be involved.
And some of those high needs may be because of environmental issues that, you know. Well, that's good to hear, because honestly, social media would just have you believe that
No,
we're going to hell in a handbasket.
Yeah. I attend a lot of parent meetings, like for our students that are like our higher concern students, or if something's going on, and the parents are like, a lot of times they're more than willing to do whatever they need to do to support their child. Sometimes they don't know what to do. Right.
Yeah, absolutely.
And I also think because we don't have a high turnaround with our learning support teachers, that they have built relationships with those families, and so those families feel very connected to them. So I think that has a lot to do with it as well. And of course, then at tier 2, if they're needing further supports outside of the classroom, your RTI coaches, your counselors, your learning support teachers will provide that support on what else can we try. We've tried this, what can we try next? Oh yeah, this is it, how to have a conversation. Some of our new teachers, that's one of the struggles when we did, is that they just don't know how to ask the right questions. And sometimes when I go into a meeting, I ask the tough questions. I ask the hard questions, and the teachers are like, oh, I don't know if I could have asked that question. But parents just want what's best for their kids, and we just have to ask sometimes. Sometimes a parent will tell me, I'm not going to tell you the answer to that. That's okay. We've asked the question.
What kind of a question? Sorry, now you've got me here.
If we're asking about doctor appointments, outside supports, if they're seeing mental health, if they're on medication, like sometimes they just don't want to share that information, and that's okay. They don't have to.
No.
But it's better if we have everything on the table. So. And then we do use our behavior tracking plans in Review 360. And then we are going to be meeting with our learning support teachers to talk about functional behavioral assessment. So providing our LSTs the ability to go in, do an observation on a child, to target the behaviors that are causing the most disturbance, or which behaviors we need to make some changes with the student. So usually our coaches do that right now, but our learning support teachers, sometimes when you go in, they're like, oh, we just need to look at that one behavior and put an intervention in place, which may be replaced by other behaviors once you get that behavior. That usually always typically happens as well. And this is our tier 3. So that is our next step for our learning support teachers, is providing them with the supports to do an assessment in the ABCs. And this again just is sharing. We have our CTPs, our collaborative team plans that are developed. We do a 4 to 6 week check-in. And it's so interesting when you come back after the 4 to 6 weeks and things are better. But sometimes it takes that outside person to say, okay, the data has gone down. Like they may be out of their seat only 3 times in a lesson rather than 30 times. So this process, all the schools now have this and they're building it into their SSTs or SST meetings specific for behaviors. And again, we reiterate, we don't want to see any schools struggling. So you're always going to be calling in your coaches to support kids for any student that may be exhibiting higher levels of behavior. Those are our QBS plans, which I've shared extensively at another meeting. And now this is something we're so super excited about. So, and Grant Taylor and Amber Cornwall, they have been working on this for like 3 years, and we've been building this. So this is now connected to our website for teachers and staff. And so it's basic, and it's all targeted towards behavior, self-regulation. So it's our, so we've got all of it here. And then if teachers are looking, and we're going to continue to update it. So if teachers are looking for core supports, so we've got our PBIS, our positive behavior interventions and support. So every school will have a behavior matrix based on PBIS. And now we're starting to see more in classrooms. Teachers are making them with their kids, and we've seen the power of that collaboration be very for class-wide management. And then it's just, we've got assessment, so, and then regulation. So anytime, if they're looking for any topic, they can just click on trauma-informed strategies. So this is all the work that has been done in the past, and we've pulled it all together into one spot. And this is relationships, proactive strategies. We always want to be proactive. So then they can just click on those, and then it takes them to more resources and information. Or if we've done a presentation and a PD, it'll link to there. So we've had some great feedback on this one because it's all in one place. And then core and more, so if you're looking for more strategies, then we've got our supports at level 2. And then there's self-regulation at tier 2. We've pulled some items from our, this daily point sheets right from Review 360. So parent conversation guide. So if they clicked on that link, it takes them right to there. Everything's connected now. So we're very excited about this. To be able to share with everybody.
And that's just available for teachers to sign in. It's all there.
Yeah, it's on our division portal.
Awesome.
So EAs can access this, SLPs, counselors, all teachers, everybody that has access to that. Oh yeah, and then we've got the core and more. And then if you click on the methodology, it's that document that I took you right through. So, and I do know 2 schools that linked this right into their SST meeting. So they're using it, so we're excited about that. Sorry. Okay. I think that might be, so that kind of is that professional development piece. So then this is our 2 new trainers. We have 2 new trainers for QBS. We have Alicia Hood she's a learning support teacher at Esteban Comp, and Jonathan Podzinski as the learning support teacher at Oxbow. And then of course we have Amber, Jody, Lonnie, and Jody Copeland, who are veteran trainers.
So Tracy, what's QPS?
Quality behavior safety. That's our de-escalation strategies that we use with all kids. So we continue to train. We just had a recertification for our counselors. So we have 19 counselors. We do our learning support teachers, our EAs, administrators, and classroom teachers are trained in this. So these are, and if we have EAs and teachers that are classroom teachers that are working with students that are continually exhibiting levels 3 to 5, we try to get them into a training right away.
Thanks, Jim. I was going to ask, but I knew if I waited a minute, you'd ask.
One thing that's new is that a lot of our teachers are like, well, I can't do that strategy because I'm not trained in QBS. Not true. They're de-escalation strategies. They're just good behavior strategies. With QBS, unfortunately, we do have some in the past. We've had to do a physical management to ensure the safety of a student running out into the middle of the road and all the buses are coming. So we do have our administrators are trained if they have, and one other person in the building are trained with, but I mean, if you see a child in danger, you're going to do what you need to do to keep them safe. We started QBS Moment of the Month. So this one just went out in April. So just talking about, this one was about ABCs, what happened before the behavior, what was the behavior, what happened after the behavior. So just recognizing there's always a reason, there's always a trigger for behavior. So we have, so this was April, so it went out as a did you know, and then we have one ready to go for May on reinforcement, I believe it is. So just trying to continue to support our teachers with behavior. So that's it for the behavior section and the censoring the PD. And so this is our transfer, lift, reposition training, TLR, I'm going to refer to it as now. So we have 2 division trainers, Lakin Hillstrom. She's our instructional coach, early learning and care, and our Jordan's principal service coordinator in the East. Last year she was a diverse needs coach. And Angela Gervais is our OT. So we've been training since 2021. And then any of our students that that require those TLR guidelines, we have personal care plans developed. Those personal care plans include the guidelines. The posters are up on the wall. Our LSTs go over those plans with the EAs. We really are trying to cut down on any workplace incidents. So basically, it's all about safe body mechanics. Even our pre-K EAs all received it, and our K EAs, because they're bending down and working with little kids. You bend over the wrong way, you're gonna hurt yourself. So it's not just for our kids in wheelchairs that we're transferring, but it's also for those pieces as well. Even when they're working on the floor with little kids, they teach them proper ways to get up and to minimize risk of injury. So this is just, again, safe body mechanics, object moving, so if they're picking up items, how to move those. And then they get into the student moving. So we never lift a student. We always transfer students. The only time we lift is when we use our mechanical lift. So they transfer into a sling to move them onto the floor, onto a bike, onto their therapy beds, so that we have nobody lifting. No matter how little they are, we don't want anybody lifting.
About how many students in our system would be wheelchair or physically unable to move themselves?
I have 5.
5?
6. I'm counting in my head. They're 6. They're not all in wheelchairs, but they still require some supports for those pieces. Of 4 in wheelchairs. So we do have 14 learning support teachers that have received the training over the 3 years. And the reason we train the teachers is we don't expect the teachers to do the lifting and the transferring the training, but they have to support their support staff. So they have to know how to do it properly. And when they go over the personal care plan, they need to be sure that they know. And sometimes, unfortunately, there's no EAs there, so the LSTs may have to step in. We did 1 instructional coach. She wanted to be able to support her learning support teacher, so we trained her. And we have 36 EAs over the 3 years that have been trained. I think that's in Legacy Park, WCF, Brokenville, and Gordon F. Kells were the ones that got trained this year. And then this is new to my portfolio, my SLPs. So we have 8 SLPs. So we've kind of been doing a review and overhaul of our speech language referral process. We're trying to make it more streamlined to align with all of our other processes. And we are going to be looking, I just had a meeting with them last week about Tier 1 literacy supports in kindergarten and grade 1. We spent a lot of time digging into our PASS screener, which is the phonological awareness screener. In K and 1, we still have a lot of schools that aren't where we need them to be, and they need that strong understanding and grounding in phonological awareness to be able to learn to read. So we've got a plan to focus next year on providing the SLPs will be in those K and 1 classrooms a little bit more, providing those tier 1 support. And we moved our SLP referrals to Clever, and we'll be moving a couple other things into Clever with the SLP. So, May 16th is SLP Day, and so if you see them around, they've got new T-shirts that we're sporting, so they're pretty excited. They're very important to our literacy plan, and so just making sure they're recognized. So the last thing, there is a book that I just left on the tables just in case you wanted to learn a little bit more about Jordan River Anderson. I had the privilege of being invited to the national, by the Assembly of First Nations. They hosted the national gathering, and it was an amazing, amazing 2 days. So they brought coordinators together from all provinces in Canada. We spent 2 intensive days, presentations, networking, right from 8:30 to 4:30. We also participated in a smudge and an offering, and a lot to do with truth and reconciliation. So it was very humbling to be there. And so this is little Jordan River Anderson. So it was all dedicated to Jordan and his family. So Jordan's from Norway House. He was never spent a day in Norway House due to his complex medical needs, and nobody could figure out who was going to pay for what. So he passed away in Winnipeg in the hospital, and then that's where Jordan's Principle was founded.
By the way, this book does an excellent description of what it
That's
is.
very
Yeah.
good.
I never understood until.
No, it's good.
Yeah. This is Jordan and his family when he was in Winnipeg in the hospital. And this is his sister Geraldine, who wrote the book. This is another service coordinator from Saskatchewan. It was really great to be there because we see each other on video, but we've never actually all met together. So I had a chance to make a lot of new connections and talk about what's going on in our family. Jordan's mom has passed away since, I think it was a couple years ago, but their family continues on the legacy. And this is the first book that Geraldine's wrote, and there's another book she's writing in right now. So this is just, this Helena Gaspard was one of the best presentations. I've been immersed in it since 2016, I think, but you don't really get a full understanding of where it all started. And this lady was amazing to listen to. So, and they're really digging into where is Jordan's Principle going, because it's kind of gone off track. It's, as Shelley knows. And so this is where they're talking about what are the inequalities that really exist for our First Nations children, and how are they affecting those children? We know that we're addressing some gaps, but are we addressing the right gaps? So she is still doing a lot of research from Ottawa, and when they talk about substantive equality, we always write our application with that, but I didn't really truly have that understanding about it really ties back to the child and what that child needs to be able to be successful, to be able to be healthy, and to be able to thrive. And then there was a lot on the politics, which still is hard to wrap my head around. Yeah. And there's lawsuits, and there was so much to take in there. So they are talking about going back to basics. So they're talking about creating implementation guides we must follow. Talking about being non-discriminatory and center on the child. And then be simple to access, timely, and minimize the burden to the families. Because this is where we're not right now. We used to be, but we're not anymore. This was just, they don't have current data, but this was just one. So these are the number of applications that got sent into Jordan's Principle. Saskatchewan from 2019 to 2021 are in Saskatchewan. We went up by 102 applications being sent in. But that could be because we started to have a better understanding of what we could apply for and what kids need. Plus, we had our service coordinator that were making more connections with families. So there's a number of reasons why those ones increased. And Nova Scotia and PEI decreased. Nova Scotia and PEI actually took on more responsibilities at a local level. So then their applications to the provincial and national decreased. So this is what I learned. Provinces are all experiencing long wait times, with the exception of Quebec. Some provinces are longer than others. Our wait time is about 10 months for applications not urgent to be approved. Urgent cases are addressed timely. It's lost its focus, reason why back to basics. Social media causes so much frustration and anxiety because someone will post, oh, I got approved for this, and then the call center is flooded with calls. Our processes are very similar. The passion is very evident. Focus on reconciliation was very evident within the room. And we have very dedicated and caring service coordinators. And I have Shelley to support. She supports a lot of Jordan's principal as well. I should have put you in there, Shelley. These are our two, Shannon, she does our H6018, and this is Lakin. She is our new one. Lee's retired last year. So Lakin has been supporting this year, and it's been a huge learning curve for Lakin. So, again, we support On Reserve, Pheasant Rump, Ocean Man, White Bear, Arcola, Stoughton, Carlisle, Gordon, F. Kells. Currently, we're supporting families in Radville, Lampman, Estevan, and Weyburn. We support them with transition into school, into the workforce, post-secondary. We support attendance. We connect families to outside agencies. And these are all the applications that we submitted within the last year. So we've got respite care, child and daycare, renovations, accessibility, washrooms, ramps, fences for safety. We had 2 wheelchair accessible vehicles, summer camps, OT therapy, SLP therapy, lots of sensory items so they can have them at home. Tutoring, amazing tutoring success story. We had a student who is 15, non-reader. We got him an assessment in Regina. We got him a tutor. He's now reading beginning grade 2. So within, I think, 7 months of tutoring. So from going from an illiterate reader to grade 2, we are celebrating that. So specialized orthotic shoes and arm guards, unbelievable the cost for those items. ASD, again, it's psychological assessments, dental, not covered through NHIB, and technology to support. And that's it. Sorry, it took longer than we're supposed to. It's very informative. Very good.
Was that bad? Was it Tracy?
What?
Wasn't that bad?
No, my heart stopped racing.
You did an excellent job. Thank
Yeah,
you so
very
much.
interesting.
Thank you. Thank you for all the questions. They were great questions.
I need the name of that book. I've got Stuart Schenker, but I haven't got the
It's in
name.
the PowerPoint.
Self-reg.
It's on your PowerPoint.
Oh, is that
Yeah, it's
called
self-regs.
self-reg?
Self-regulation in classroom.
Very interesting.
Thank you.
Are you collecting these, Tracy, or?
Yeah, we still want to read them, or if you want to keep them, you can keep them too.
We?
Yeah, you can keep them too.
Yes, thank you.
We ordered quite a few. So.
Okay, all right.
Okay, thank you.
Thank you.
Tracy.
Oh, sure.
Yeah, that's the last one you read. Well, it might have been 15 pages, but. It's more than I.
7. Oh, it says the proposed motion first.
Yeah, we need a motion for the learning supports report. A motion, please.
A motion that the board acknowledge the receipt of learning supports report presented by Coordinator of Learning Supports Tracy Kilman. Clinic, with a focus on intensive needs student data, professional development for diversity with a focus on sensory, self-regulation of behavior, safety for staff, and Jordan's principal.
Thank you, Megan. Heard the motion. All those in favor? Opposed? Motion carried. I saw Eric smiling, he was waiting. I thought he was waiting to race you.
I thought he was too.
Okay, so now,
Arm wrestle.
number 7 is the director's personnel report. It has been posted for your review. Do you have any questions for Keith?
I will move that the director's personnel report be approved as presented.
Thank you, Eric. Any discussion? All those in favor? Opposed? Motion's carried. And 7.2.1 would be the 2024-25 school year calendar. And as always, the calendars were developed and put out for all of our staff to vote on. And I'll let Keith speak to that. Mind?
Yeah, so the vote was, Mr. Hiskey worked with the SECPSD committee, as well as Holy Family, to come up with a couple of options for voting. In this particular year, you would have known that one had an Easter break, one didn't, which gave quite a bit of a difference in options from the two. So the vote was put out earlier last week and ended on Friday. So it's quite overwhelming that 85% of the respondents voted for the option 1 at this particular point.
As always, we support the motion that our staff are looking for. Unlike other school divisions, we don't necessarily do that.
I'll make that motion.
Thanks, Kevin.
Motion that the board approve calendar option 1 for its school year calendar for 2024-2025 as presented, subject to the approval of the Minister of Education in terms of the compliance with the Education Act regulations.
Thank you.
So there'll be a media release tomorrow and joint with Holy Family to announce the people.
Option wise, and the ministry approval is just a formality. We know we know that we're in compliance with the Education Act. So are you ready for the question? All those in favor? Opposed? Motion's carried. 7.2.2. The HR committee has been very busy over the last few months reviewing all of our policies. And so finally to time for adoption. So I'd be looking for a motion.
Okay, and thank you very much to the committee who spent quite a bit of time going through to bring it up to date. So I will move that the board adopt the revised Southeast Cornerstone School Division number 209 Board Policy Handbook as presented.
Thank you. Thank you, Tammy. All those in favor? Opposed? The motion is carried. 7.2.3. Would you like to speak to that, Keith?
Sure, and I think the bonus spoke to this quite well at the start of the roundtable. We're very fortunate to be able to work with the Playfair Daycare and town of Moosomin in terms of allowing them to have some of the land that we have at the south end of the playground. I think it benefits families in Moosomin. It benefits our students and our parents that have children in daycare that can walk right across the playground to go to school when they're of that age. So I sort of like that. The town of Moosomin, the Community Builders Association, just wanted to make sure that thanks were given to the board for that, the generous donation of land, and the motion is there.
So,
I'll make the motion that the board sell the land at the south end of the McLeod Elementary School playground as outlined in the map presented to Playfair Daycare for the amount of $1.
thank you, Devona. All those in favor? Opposed? Motion is carried. Okay. Information items, there's nothing requested. No monitoring reports this time. Our next meeting is May 1st, and that will be a lot of focus on the upcoming budget preparation. So we meet then in the afternoon. Then we have our committee meeting on May 22nd and business meeting in the afternoon on May 22nd. And that's all I have. Is there anything else?
I will officially adjourn.
Jim, meeting adjourned, all those